All right, so these are the instruments that we use for our minimally invasive, energy-based neck lift and contouring procedures. And we'll start over here. This is the instrument that we use for the numbing medication. It's a long, thin, blunt cannula. And you can see that it's very, very small, so the access port for this is tiny and heals nearly invisibly. The next step in the procedure is we use this device, which is called a vaser, and this is a wand that goes through that little access port and emits ultrasound energy, and that does a couple things for us. The main things that we're interested in is it actually vibrates the fat cells off of the surrounding connective tissue, so that when we suction them out, it's a much less traumatic process. There's less bleeding, there's less bruising, and it's just kind of a faster, more comfortable recovery. And this is the kind of thing that you can really do on a Friday and be back at work on Monday. The next step in the procedure, for folks for whom it's indicated, is we use our face-tight bipolar radiofrequency skin tightening device. And this is one pole that goes through that little access port and goes under the skin. This is the larger pole that stays over the skin. And if my hand is your skin, we run it essentially like this. And it's shooting radiofrequency energy between the poles across your skin, and that heats the tissue, leading to skin tightening. And then finally, the last step for folks in whom it's indicated, this is a liposuction cannula. Again, it fits through that tiny little port and it suctions out the extra fat. So between the skin tightening that you get from the face tight device and the deeper tissue tightening that we get from the vaser, so in addition to vibrating the fat cells off connective tissue, the vaser actually heats that deep tissue and tightens things up. You get a really nice contour without kind of the long traditional incisions or downtime of a more traditional neck lift.